Good morning, everyone. I hope you're doing well, and I hope you can hear me. Welcome to today's webinar, looking at our transition from Datex to InPhase. Really excited, and thank you all for joining us. I can see there's quite a few of you. We're up to sort of in the 30s, so that's really good to have so many of you join us, and I know you're all really busy. So thanks for taking the time to be with us today to meet the InPhase team and get a demo of what the system will look like for us here at the NNN. Another thank you to all of you who joined us in the atrium back in January with all of your comments and questions. We had a really well attended session there. And thank you again to all those of you in Chroma who came to see us earlier in the month. Really helpful to get your feedback on the current system and to get your views on what the new system looks like. If there is anyone who wants us to come and do anything like that with them locally, then please do give us an email or pop it on the Q&A on here today. We'll arrange for us to come and see you in your area, give you some demonstrations of the system, have a chat with you and see kind of what your local needs are as far as a risk management system goes. So I'm going to quickly introduce you to the team. So just going around, we've got James with us today. James, do you want to introduce yourself and what you do?
I'm the risk management systems facilitator, and I've been managing the Datix system for quite a while now. And in the transition to InPhase, I've been doing a lot of the local implementation and design. And I've already met with quite a number of people who may be here today to go through their processes and figure out what you need and to try and design that into the system, and yeah, hope to continue doing that. And just while I'm talking, just to let everyone know, today I'll be managing the Q&A, so if anyone's got any questions you want to ask, there's a little Q&A icon up at the top of the screen. Just go in there, ask any questions. I'll be collecting them. Some I'll be answering in the bar, some will be answering towards the end.
Fabulous, thank you, James. And next on my list, Katie.
Morning, everyone. So I'm Katie Bacon. I'm one of the account managers over at InPhase IdeaGen. Recently come into the business, but not new to healthcare IT. So recently was at EMIS. So transitioned over, and I'm here to support the trust, looking after obviously the implementation side and just the general day-to-day relationship side. So I would like to reiterate what Perry said. If there's anything that you need in terms of awareness, then please do reach out, and we're more than happy to support that.
Brilliant, thank you, Katie. We've also got with us today in the background Abby supporting us with the production of today's webinar. But Abby is instrumental in keeping us coordinated when it comes to the rollout of this project and getting InPhase live. So I just want to give my thanks to Abby, and also I'd like to give my thanks to Anna Duckworth, who's done a huge amount of works with sort of the promotion of InPhase on the beat and with sort of regular communications. Has done a lot of the kind of graphic design stuff for us. So thank you to Anna for all of her help with that. And there'll be a lot of other people who've reached out to us to be involved in the development of the system. And we'll be in touch with you sort of closer to the go live date to get you involved so that we can make sure that the system is as good as it can be. I will just quickly then walk you through where we are in terms of our sort of roadmap that we've got. So you may or may not have seen this roadmap previously. Essentially, we are currently in the sort of somewhere between the design and testing phase. We've got some of the apps built in their kind of skeleton form. We're testing those and adding the additional sections and extra value bits into those as we go along. We go live with the first sort of phase of InPhase in May. So that will be phase one, is looking at replacing all of the functionality that we currently have in Datex. So many of you will use Datex for incident reporting. That's the core sort of function that we use Data Explorer at the moment. And then obviously the subsequent management of those incidents. We also use it to record risks, patient feedback, legal and inquest information, things around safety alerts, clinical audit, and a few other kind of smaller functions are captured in the system. So all of that will be live and ready to go on InPhase at some point in May. We then have phase 2 of the implementation plan. So for those of you who use Tendable or you use LifeQI, that is the phase where we'll be introducing those functions into InPhase, and we'll be winding down the use of Tendable and LifeQI. And then on into 2026, we'll be looking at what additional value-adding apps, modules we can build into the system to really enhance the use of the InPhase system. So I'll just stop sharing my screen there. Along with the phase 1 piece, or just before phase 1, before we go live, we're looking at a point in April to have some videos ready for you in terms of kind of training. So it's a question that comes up quite regularly. People ask about when are we going to get an opportunity to see the system and have some training. There are some demo videos already on our InPhase Beat site. So if you have an opportunity, please do go there and have a little look. There's also a demo form on the Beat site as well that you can get a little bit of a look and a feel as to what an incident form looks like. But in April, we will be producing some training videos for you. Shortly, Katie is going to sort of give us a bit of a demo as to what the system looks like. But just a caveat, because of the customizability of the system, our system, when it goes live, will look quite different to what the InPhase kind of general demo system looks like. So just to note that kind of some of the colors, some of the reports won't look exactly the same. We have a lot of kind of scope to make the system look and feel how we want it to. So Katie, is now a good time to hand over to yourself?
Yes, absolutely. So I'd like to hand over to John, who is going to walk us through the system. As Terry says, I know we've seen some of you maybe before over at Norwich and at Chroma. So some of you may have seen this. And as Terry says, caveat that the system looks slightly different. This is a demo system, but generally we'll take you through the steps of how the system will work and the key features. So I'll pass you over to John now. Thank you, John.
Yeah, thanks, Katie, and morning, everybody. Thanks for having me. And Perry, it's not a problem at all. It's all good. I'm 6'6", and it makes a change not to be seen.
Sorry, John, you didn't come up on my screen, so I couldn't see that you were with us.
It's all good. It's all good. As you know, I'm a quiet and shy, retiring type of person. So let's get into it. Just to make sure it looks like I can see it on there. Can I just get a shout from Perry or from Katie that you can see the Ward 1 on the screen?
That's fine, John.
Fabulous. Okay. Apologies to everybody that's seen this before. Apologies for those who have heard my dulcet tones on this before. This is where I tend to start when I'm showing anybody InPhase, because this is the point that we're aiming to support you, your organization, to get to. Some people call this triangulation dashboard. That's what it's called at the top here. Some people also call it the golden thread. What's happening? What's going on across the entire organization? Obviously, Norfolk is an absolutely stunning part of the world, one of my favourites, but there are quite long drives and distances to get to lots of different places. So what we're hoping with InPhase is that you're going to be able to record information in lots of different places, which are then going to be able to tie information up and start showing you what's happening at all these different locations. A couple of words that you're going to hear in the next days, weeks, months, years, and certainly in this demonstration are portals, widgets and apps. A portal is a page which something sits on. So this is a triangulated dashboard portal. Across the top, we've got integrated assurance. That's a portal. Integrated governance. That's a portal. Basically, everything that you see that has something on it is called a portal. Things that sit in portals can be smart forms, which we'll have a look at in a second. One of the big things are widgets. So this is not a Boddington's commercial with Jack D showing my age there. This is a widget. This is a widget. And this is a widget. It's pretty much a visualization. It's something that shows data in a certain way. So on this particular version, this is a demonstration. It doesn't need to look like this, but this gives you an idea of what the art of the possible is and how we're hopefully going to get you to the point of seeing everything. We can choose which area that we're going to look at. We're going to look at Ward 1, and we've got some information on who's responsible. We can see incidents and other information across the top. We can see what the CQC assessment looks like. We've got some KPIs here. We can also see Ward 1's risk register. We can see the incident trend over the last few weeks. We can see what type they are. We can see if they were serious. We can see this is the tenderable side of things. This is where we can see compliancy. So any audits that are due to happen in this area, where they are and what the compliancy rate is. We can also see whether there are policies and there are nice areas, as in nice guidance areas within the ward as well. One of my favorite areas, which is really, really a key part of the system, is this area shows every single action which is undertaken and being dealt with across multiple apps across the entire ward. So this isn't action planning. This is, we can see that in audits, somebody's doing something and this is where they are. And because it's all part of the same system, all of this is interactive. So if you double left click onto it, you can go into it, you can see some additional information, and you have the ability down the right hand side here to add your own blogs. So that's where we're trying to help people get to. This is how we're going to be supporting your organization to get to. So how do we get there? We get there by using apps. So again, when you speak to anyone within the organization that has anything to do with InPhase or an InPhase person, you may hear the word apps, and that's what these are. Some people call them modules, some people call them functionality, just to give you an idea that that's what we're talking about. And each one of these has a central place where we can put information. So what does a new form look like? At the moment, this week I've been on site with two organisations, with Chesterfield Royal and with private organisation Spa Medica, and they've told me that the way they get to their incident forms is they click on a link on their intranet and it takes them through to an incident recording form. Pretty much the same. We also have the ability to QR codes. Not saying that's what your organisation is going to do, but that there is the ability to do that. And when you open that up, this is the form that you'll see. Two caveats to that, and something that Perry said at the very start, is this is a demo system. This isn't exactly how your form is going to be content-wise, but this is the general gist of how it will look sort of visually. Anybody that's done any online pet insurance, car insurance, travel insurance, that sort of thing, this should be fairly familiar because it works in exactly the same way. For example, if there's a red star next to it, you have to complete it before you can do something with it. If there's a question mark next to it, it means there's going to be some data in there which is going to tell you what it is. If there's a button, you can press it. And in the same way, for example, if you're doing travel insurance and you say that you need to put some medical information in, once you choose that, it will only show you the questions that you need to answer based on your last response. So it's an if this, then that form. A couple of other things to point out. If there's a clock, you can add a time. If there's a drop-down box, you can choose some information. If there's a silhouette button, and I haven't spoken to Perry about this, but there is the potential that you can put your pictures in there as well, so you can see who it is that you're choosing. I'm not saying that's a good idea, but it is possible to do. But all your staff files will be in here, so you'll be able to pick somebody. You do have the ability to put free text in as well. We try and avoid that as much as possible when putting systems together, although ultimately it's your system. And the main reason for that is that once you start putting free text in, it becomes difficult to be able to show reports, do reports, and ultimately do that triangulation. One other thing just to mention at this point, this is at a point where somebody is recording an initial incident. You do have the ability to put photos and documents in there as well. A little bit of a spurious statement, but actually if you're out and about and it's dark and somebody unfortunately has an accident in the car park where they trip over a pothole, You could be recording this incident on a mobile phone if the trust allows it, and you could take a picture of the pothole and the location as part of that, save it before you then press the submit button, and it goes through to the next step. Once that's done, it goes into a management area. Anybody on the call that is going to be an investigator or a reviewer of incidents and other areas, which I'll come on to very shortly, you will also have access to this area as well, because you're going to need to be able to get into the records to be able to see what's going on and do something with it. Once we're in that area, again, quick statement, quick caveat, your system may not look exactly like this. This is functionality. This is to give you an idea of the art of the possible, but these buttons are quick slicers. Apparently, these things here are called slicers, so you can drop down and you can pick things on here. But if you want a quick button that will allow you to do something, instead of doing 3 or 4 clicks by one, you can do this. This will then bring up a list of something. And this, again, can be for any type of report that you want. All of these columns are also customizable. As long as there's information recorded in the smart form, you can put a column in with that information. But ultimately, what we want to do is we want to be able to update it. To put information into any part of the system, as you can now see, is exactly the same. So putting the information in initially for an incident is the same. Going in and adding additional, it's the same technology, it's the same form. We can already see that there's some data completed. We've also got the ability on this stage, because this is the next part of it, to pull information from other systems. And it's then a case of going through, clicking buttons, drop down boxes, etc. 2 other things to mention that are available in all of the smart forms, in all the questionnaires, across all the apps across InPhase, is everything you see on this form is something that could be added. These 2 areas are key and tend to come up from a second point. We've got the actions button. This is where you can ask somebody to do something. So by clicking in here, my writing is terrible at the best of times, including typing when I'm being watched, but you would put the task name in here, you would put an overview, you would assign it to the right person, press the create button, and that would then send an email to somebody to say, John has asked you to do something, please can you review? They'll be able to click on the URL, it will take them through, they'll be able to complete it, and once that's done, you'll get an email to say this piece has now been done. What you'll also get is access to an action tracker. Again, this may look ever so slightly different, it may work different, but what this means is you can keep track of all of the things that you have assigned somebody to do. So as well as the system prompting the other person in lots of different ways, you can do it. You can keep an eye on it, you can see what's happening, and if there are any notes included in there, you can give them a prompt to do something with it as well. Back into the instant form. This is where triangulation really starts to kick in. And again, everything you see on here is going to be available in other apps as well that the trust decides to, potentially feedback, potentially freedom to speak up. The point of this is an incident. If there is a risk that we already know about, that is one of the reasons this incident happened, you can add that risk here. If a claim comes in as part of this incident, you can add the claim in here. If there are policies that are linked in, so for example, if there should be somebody going round in the evenings, especially during winter, to make sure that the potholes are either covered or there's an alert system, I can't think, a little A board next to it, for example, you can add that in here. And this then starts building the story, starts linking things together, and starts allowing that triangulation of data to say, actually, this risk is probably bigger than we thought it was, because now we've got 10 incidents next to it. It's that sort of ability that putting that information in and showing it you in a easily presentable way that you can start spotting those trends. So once you've got that information in, what can you start doing with it? Well, we've got the triangulation dashboard, which you've seen, but it allows you to then do dashboards, live dashboards, real-time data dashboards like this. So this is an example of a 12-month incident report. Depending on who's logging on will depend on how your screen is presented. So for example, if you are a maternity reviewer and a maternity assessor, you may decide that actually you don't need to see everything on there. You only want to see maternity incidents because that's your focus. save a couple of clicks, you can do that in the same way that if you're only interested in the reports for the last weekend's worth of incidents for maternity, that can be set up. It will recognize from your logging. And these are the type of things that you can then see. My point about seeing trends is this is how you can do it. All of a sudden you can see rise, you can see peaks, you can see troughs, you can see where things might be happening. You can also say, should we have this many pressure ulcers on here? Well, actually, based on the situation with beds at the moment, yes, we would expect to see that. But what's interesting is down here, we've got the instance by speciality. Elderly medicine, we've got 1,200. We've only got 3 people working in that area. Should it be that high? Let's go and investigate it. So again, making information just by people doing their day-to-day jobs really easy to see, really easy to spot trends, and actually then go and do something about it. So we've talked about triangulated dashboards and the type of widgets that you can see. We've talked about how we get the information in, which is done through the incident forms. We've talked about the information that you can then see, some of the widgets, some of the reports, some of the visualizations. And ultimately, that's how the entire of the InPhase system works. Whether you're using incident, feedback, for example, quick look into the feedback app, you can see if we want to capture some feedback, it's exactly the same type of form in exactly the same type of process. If we want to go in and do something with it, we can choose, let me just see the complaints. Again, I'm logged on for maternity, so I only see the maternity and I go in and update it. If I want to see some reports, I can go into the reports and it will give me what I need to see. So the entire system looks, acts and works in exactly the same way. So it becomes familiar for you to use. It becomes easy to spot those trends, peaks and troughs. And ultimately, 2 last pages. These are examples of triangulated databases for other things. This is specifically for the COVID-19 focus, but you can see on this one, we want to see what the service review is. We want to see what the risks look like and any action plans that are based against it. And another example of some of triangulation data is an action assurance page where we pull all of the actions in from the entire organization. But again, that can be dropped down into areas, directorates, wards, and again, you will only see what you need to see. I hope that's been useful. I'm going to stop sharing my screen now. I know the team are standing by and may have questions throughout. That's just a whistle-stop tour of what the system is and what it does. Just to review, get the information in, nice, simple, standard form, put the information into widgets, easy on the eye, easy to pull through, easy to then put into other areas, which can easily spot trends. And ultimately, we're all here for the same thing, is to try and make everybody's life a little bit safer. So at that point, I'll hand back to Perry and Katie.
Brilliant. Thank you, John. Katie, is there anything else you want to add?
No, nothing else from me. Thank you very much, John, for going through that. Perry, are we handing over to questions and answers?
I think now's a good time to go on to Q&A. There's lots of chat on the right-hand side I can see. So thank you all for getting your questions and some really good ones on there. I wondered if we might just open up with a couple of sort of general questions, if that's okay, John and Katie. So just interested really, and for other people on the call, around kind of what other trusts regionally are using InPhase, and how they found it, what the impact has been of them introducing InPhase, and so on.
Yeah, happy to answer that from my area. So I think some of you might be aware, maybe not aware, that we already currently work quite locally with other trusts in the area. So we work very closely with James Paget. We also have a couple of community trusts under us within the area, and the ICB as well. So you know, the hope is, I guess, from our point of view, that the whole of the area will move forward to continue using InPhase, which obviously supports with interoperability and helps kind of tie everybody in. John, from your point of view, you obviously cover the North and London. So I don't know if you want to kind of talk about what we've got in those areas as well.
Yeah, absolutely. So, just a couple of things to say out loud. The first one may sound a wee bit scary, but it sounded scary to me as a newbie 2 years ago into this particular part. I should just say as well, sorry, I didn't introduce myself at the start. I'm also an account manager and I work with Katie. Katie covers part of the country, I cover the other part. Um, so I've been in this industry for unbelievably 25 years, but coming into patient safety new. So I went to see an organization in the Northwest when they'd just gone live with InPhase, and I asked them how it was going. And they said, oh, we've had a 500% increase in incident reporting. I was, wow, she went, no, that's really fantastic because it shows that we weren't doing it before because we've now made it easier for them to do. I guess one of the challenges that we've got is we've now discovered that there is a misunderstanding of what an incident actually is and how it should be reported. So actually that within a couple of days they were able to spot some things that they needed to get better and do that and take that all as a positive. The other thing I guess to say is we've got a whole group of people very similar up in the northeast, and they have a working group. So that's Newcastle, Northumbria, Gateshead, Sunderland, Southeast, Northeast, County Durham, and Darlington. There's always one that I forget. Tees Eskinware, that's right. So they're all working together in the same place, looking at, again, interoperability, sharing information. And the key message that I've heard from all of those people is that we've never had access to this type of information so easily just by doing our day jobs. And actually people seeing those results quickly and easily gives them, I wouldn't say word hope, but it shows them that what they're doing is actually making a difference. And being able to see that with their own eyes has been really positive for the organizations.
Brilliant. Thank you very much for those answers. James, you've been keeping a track of the Q&A on the right. Is there anything on there that you want to?
Yeah, there's a couple on here that I think are worth bringing up. We can probably run through most of them really. The first question was about AI functionality, and I wanted to bring it up because I'm sure I've seen that's on the roadmap for InPhase in the future. I just wonder if you can talk to that at all briefly.
Yeah, absolutely. So we've been at last year's user group. So we had a North England, South England, and a Scottish user group last year. And our product manager, Paul Clinton, came along and talked about AI. As some of you may know, InPhase was acquired by IdeaGen last April, which that's a year is quite scary. And he went through the AI offering that's going to be put together. IdeaGen already has products that has AI integrated, so they have a full AI department that supports and does that. Initially, we have in our demo system, which I haven't shown today for timing purposes, is we have what would be the word, a proof of concept where, for example, in the incident, we can ask the AI to create an action plan based on an incident or a group of incidents. We can ask for an overview of the incident and see if there are key things that have happened, and maybe it can spot what could be done, and then that could be linked into other areas. For feedback, we've got automatic response letters and holding letters, which use the template functionality. I'm using lots of quick words here, but again, very aware of timing. Ultimately, the next step is going to be finalizing those initial areas. We're looking at about 6 months at the moment to get that into the majority of customers based on where we are today. And then moving on to things like asking it, the AI, to say, show me the incidents where this is a thing, and it will bring up the report automatically. So saving time in building multiple reports and being able to do more bespoke stuff. So that's the plan for at least the next 12 months. We do have a proof of concept in there, and they've got some big plans for what that's going to look like in the next 12 to 18 months.
Great. There's a few questions on here that I just want to quickly touch on about reports, and there's a few of them that are talking about our old data versus our new data, and our and also on being able to analyze trends against other areas in the system, such as like patient numbers in there. So, and I have already answered that we are planning to bring in our archive data, but they may be in separate areas. I believe, I presume, we where there is common piece of information, we may be able to report across those two different areas in the future, which was Liam's question, and there was the question about being able to show it as a percentage of patients. I believe that's possible because InPhase can draw information in, but obviously that will kind of depend in the future whether or not we think it's appropriate, or whether we want to use things like Power BI for that kind of reporting in the future. Would you agree with my assessments of those? And I think the last question that we were asked was about being able to create our own bespoke apps, which we do have the app developer license included for us. So we will be creating our own apps, but obviously in phase one, the priority is the transition from Datix to InPhase. So we'll be focusing on the stuff that is already provided by Datix in the initial term. And I think that's all of the questions. I just wanted to get them in this video for the recording. Did we want to bring up anything else like FAQs, Perry? Or
Yeah, James. So just for everyone else, we on our Beat page, I'll share the link with you to that shortly. But on there, we've got some additional content which people might want to take a look at. So please do feel free to go over there. There's some short videos on there showing sort of differences between Datix and InPhase. We've got some commonly kind of mumbled gripes about the current system and how InPhase will improve the situation when we go live with that. So please do take a second to have a look at that. We've also got some FAQs on there. So James, do you want to just run us through those really quickly?
Yeah, so
you're on.
So the first one was, how will we know when the transition is happening? And the switchover will be taking place in May, and all the existing functions and modules from Datix will move across to the new system. The Datix logo will remain available for a period of time after the switchover to redirect staff to InPhase, and there'll be regular communications and updates shared via the InPhase page on the Beat, which will obviously come into the trust-wide communications. Will we need a new password for InPhase? We are hoping to utilize a single sign-on so that you should be able to log in with your trust login, but confirmation will be provided closer to the change date. If we aren't able to go live with single sign-on at the start, we will be starting to distribute logins sometime during April, I believe. Will we need additional training to use InPhase? The process for reporting an incident will remain the same, and the reporting form should guide you through the process. The system will look different, but should feel quicker and more intuitive to use, and you'll be able to access it on different devices like desktops, phones and tablets. But we will be adding training videos sometime in April for other parts of the system, which will hopefully give you a quick guide through it. And the last question was about any information that can be shared, which, as Perry said, is there's information on the Beat page. If you just look for the InPhase page on there, there's a bunch of videos and slides and backgrounds and stuff that can be shared on there.
Brilliant, thank you, James. So unless I can't see anything else on the Q&A. I hope everyone's found today's session helpful and given you a bit more insight. I've popped a question on there just asking teams to let us know if there's anything more that we can be doing to support you in terms of information around the system, in terms of promoting the system to your colleagues. If there is anyone who isn't aware yet that InPhase is coming, we want to make sure that sort of when we get to sort of mid-May, everyone knows, everyone's as excited as we are about the switch over. So please do let us know if there's anything you need, if there's some posters that we should be doing, if it's more stuff electronically, etc. So I will just share my screen really quickly so that you can see the well, you can't really see the link to our InPhase page because it's a link, but essentially if you go on to the Beat, click, search for InPhase and you'll find our page on there. There's also the QR code, so if you're that way inclined, please do feel free to take a quick scan of that and have a look at that on your mobile device. And we've also got our team email address there for you, so please do feel free to get in touch with us if you've got any queries, any suggestions, anything that you particularly dislike about the current system and you'd like remedied in the new system. We're all ears for that kind of thing. We want to make this system as user-friendly as it can be to release you guys time to do your jobs. So please do let us know if there's anything that we can do to support that. Lastly, just to say thank you all for taking the time. There's nearly 60 of you here now, so really grateful to have so many of you join us to see the presentations today. Thank you for colleagues from InPhase for coming and taking us through the system. It looks really good. We're really excited. And thank you to James for taking us through the Q&A. Thank you to Abby for guiding us through and doing the production today. Thank you all for attending and goodbye.